Welcome back. It's time to talk teeth. We're talking about how your jaw and teeth can affect your airway health, and that is the topic today. We have Dr. Preety Desai joining us, laser implant specialist, and Dr. Carrie Flintoff, orthodontist. Great to have you both on the show.
Thank you.
Yes, you guys work in tandem a lot on this issue, don't you?
Yes.
All the time.
Yes.
All the time, yeah.
So how does it work? Your jaw and your teeth, people need to be aware, especially when they have little ones, to make sure that that's going well early, that it's all in alignment.
Mm-hmm. Often when patients get referred from the general dentist as an adult, and I see obviously mainly adults, they have a lot of recession, some grinding, some snoring, some sleep apnea. And as a result, in dentistry, we've done a lot of science and research on this, and it actually goes back to childhood as to when things actually began. And it has to do with tooth-jaw discrepancies, and that's where Dr. Flintoff comes in. She sees little ones all the time, and a lot of changes that she can diagnose early.
Yeah, so typically what we'll see in kids that have really enlarged adenoids, which are essentially tonsils a little bit higher up in the back of the airway, or enlarged tonsils, very constricted kind of jaws, their airways tend to be a little bit too narrow. So I'll often hear from parents that they will either see their children stop breathing in the middle of the night. It's basically kind of a childhood form of sleep apnea.
Wow.
Or they might be really heavy snorers. So even now, snoring is considered, you know, if it's consistent, it can be considered abnormal and a form of what's called sleep disordered breathing. That can have a huge impact on a child's well-being. It's basically a childhood form of sleep apnea that can cause, you know, a lot of decreased sleep quality, which can really affect your functioning day to day. So I'm able to pick that up if kids coming in. I can see these kind of morphological changes I can pick up on and really ask parents. And often what I can do is refer them to the ENT for an evaluation. And also there's some things I can do orthodontically to help to kind of really expand everything. You know, aside from what the ENT can do in terms of managing the other parts of the airway, that can really help long term to, you know, prevent these things from solidifying and kind of carrying through into adulthood.
Mm-hmm. And once you get to adulthood, you've got a lot more trouble on your hands, I'm assuming.
Yeah, definitely. Like, you know, it's so nice to be interventional and preempt orthognathic jaw surgery. There's a lot of innovative expansion, grafting techniques, which are just under local anesthesia, and you can prevent all that stuff way before the patient gets to the point where they have massive recession and having to use a CPAP, for example, you know, for snoring, just because they didn't identify it early enough.
Yes. We have some pictures that I know you want to talk about as well. Maybe we can go through these. What are we looking at here?
And this is just an average patient that we can see as an adult, and this is their jaw and their teeth, as you can see. And there's a couple other views of it that also show the, we call this the occlusal view, the kind of helicopter view of the jaw. And you can see it's pretty beautiful, but there are some subtle differences that have followed them through adulthood. And when they undergo some, this is the other view on the other side. And so if they undergo some grafting and expansion, late orthodontics with some minor gum surgery and particulate surgery, you can change a constricted jaw with, you know, we call these tori, which affects snoring and breathing, to the point where the next photo will show the final result, and then over to the next photo you'll see the other side. And the alignment for the dentist, it's much better. For the patient, it's not much change, but if you look at the helicopter view, you can see how widely expanded the patient is. And this is not jaw surgery. This is minor interventional stuff. And this patient was on the CPAP before and is not anymore.
That's amazing.
No snoring, no cardiac issues, because all this less oxygen and breathing at nighttime is no good for the body.
Yes. Can we trust in our dentist to know when it's time to refer, so that we know that this isn't an issue? Are dentists on top of this stuff, like your regular dentist?
You know, this is fairly new research, and Carrie and I are kind of trying to spearhead this with awareness, like today. But it's really important that as a parent, if you are worried about your child, just call your dentist and you can self-refer to an orthodontist or a periodontist.
Yes, excellent. All right, any other tips, ladies? We still have another minute if there's something else you want to touch on.
I guess I could speak to what Preety was talking about with regards to the grafting and in terms of expanding arches to give the tongue more space to come forward to help with breathing. If I see an adult who needs quite a bit of expansion, typically what we do before these procedures is actually have to surgically open the jaw, which is, you know, a bit more of an invasive procedure. It requires full anesthesia and an appliance to actually kind of separate the two halves of the jaw that have been created and expand the jaw. So that's a much more invasive procedure. With these newer kind of inventions, I guess, if you will, it's made it much more patient friendly, much more feasible, and a lot less downtime. So it's kind of a nice innovation.
Local anesthetic in the office, not in the operating room. And,
Yeah, absolutely.
you know, risk of that, of course, as well.
Yes, of course. Excellent. All right. Something worth checking into if you think your child might have an issue. Never too early to check it out, obviously. Thank you to the both of you ladies for being here today to talk about that. We'll take a quick break. We'll be right back. Stay with us.